when COVID-19 struck in Wuhan, the Americans, the Chinese were very much aware of COVID-19 implications. The World Health Organization was equally aware of the implications of COVID-19. Throughout all these months, from November, December, January, February, COVID-19 grew from a small point in Wuhan to an entire city in Wuhan, started spreading to the entire world. Americans knew, Chinese knew. Few Western countries like Britain, France, Italy, and others had no clue. But they started receiving signs of COVID-19. It spread across the world. It spread to the level that it took the world by surprise, except China. That was not surprised. America was very much surprised. And the rest of Western Europe, Canada, Britain, France, and all the superpowers, Germany. The coming of the COVID-19 abrupt descending on Africa created pitfalls of variations in purchasing power, manufacturing power, acquisition power, and in the power to manage our resources. On 18th of February 2020, this year, I wrote a letter to the entire Africa to be prepared of this COVID-19. It's a new phenomenon that had arrived on the continent of Africa. It was coming. We are not prepared. We didn't have hospitals. We didn't have ventilators. We didn't have beds. We didn't have all the equipment, PPEs, all of them. No bed vaccination, no vaccine, no medicines. I warned Africa that the outcome of all this abrupt descent on Africa could be catastrophic. Today, as we sit and as we lament, as we condemn each other on the continent, it is not only our condemnation, it is the entire condemnation of the entire region, entire countries in Africa and the world. There are variations of equipment purchasing materials, some materials, competition on materials, demand on the materials, supply on the materials, production of the materials was limited to few superpowers, some of which paid in advance the entire bills. I want therefore the people of Kenya, the people of Africa to understand that it is not only in Kenya that there is a mix-up. In the entire Africa, almost out of 54 countries, 46 countries of Africa have a problem with their ministries of health. One of them, Zimbabwe, they sacked the minister, took him to prison. The General Chiwenga has taken over Zimbabwe. Another one in Somalia. In Uganda, we have 22 officials in jail. going to jail for long terms in Tanzania, in Malawi, in Maputo, Mozambique, in South Africa. President Ramaphosa has made adjustment. Nigeria, Sudan, Tunisia locked up their minister. Algeria, all these countries have had chaos because of the demand, supply, production, which was inadequate. The way people procured this equipment, some of them were actually, you had to physically go and fight to get your quota. Who knows you in China, in order to give you the ventilators that were for Africa. Otherwise, all the ventilators from China up to today have been booked by America and Germany. It is also a fact that people must understand under which circumstances the ministries of health in Africa are fighting this pandemic. It is not a very good type of pandemic. It is it's a trial. If the World Health Organization itself misappropriated the chances of even telling us what type of disease was coming, what would you expect to any African country that has one bed as an emergency? I rest my case.